There are 83 new cases of COVID-19 in New Zealand, made up of 78 new confirmed cases and 5 probable cases. This is at 9 o'clock this morning. There are 50 individuals that we can confirm have recovered. We have 12 people in hospital with COVID-19. There are 3 in Wellington Regional Hospital, 2 in Nelson Hospital, 2 in Whangarei Hospital, and 1 each in Auckland, Waikato, Taranaki, Dunedin and Greymouth hospitals. There are 2 people in intensive care units, 1 on a ventilator, and for privacy reasons I won't be providing other details on these 2 cases. As Dr. Bloomfield mentioned yesterday, laboratories are working to process and report test results as quickly as possible. Taken over a 7-day period, our average daily test number is 1,613. Anyone who has been tested is expected to be in strict self-isolation until advised of the result of their test. Overseas travel and links to confirmed cases continue to be in the most significant infection path. The combined total of confirmed and probable cases in New Zealand today is 451. Finally, I'd like to reiterate my messages over the last few days and ones that Ashley Bloomfield has also reiterated and you'll have also seen from local health authorities. Please be kind to each other. Particularly on social media, we're seeing reports of abuse to people with confirmed COVID-19. There's a high level of anxiety in the community, and it's just not acceptable to be attacking people that have been caught up in the pandemic. We want those with the symptoms of COVID-19 to get tested so we can manage this outbreak and recognise the clusters of transmission and stop them from spreading. Please don't make this any harder for people to be able to seek the help that they need to be identified as having COVID-19. We need to look out for each other now more than ever to unite against COVID-19. And as you've heard John say, the weather here is pretty awful, and it probably is in other parts of the country. It's a great day to snuggle up at home and enjoy being with your loved ones in your home where it's safe to be. Please take care of each other and be kind.
Thanks, Norm. So a more general update. This is our first weekend at National Alert Level 4, and we're very pleased with how people in New Zealand have responded this week. And I'd like to thank people for the good stuff that everybody's doing to keep communities safe. These momentous changes were flagged less than a week ago, and it's only 2 days since we've been living a new way of life. We're very quickly adapting to that, and you all will be in your own ways. I have an update from the police. They report that most people, in their view, are following the new rules. There have been some isolated incidents of people congregating. In these situations, people were spoken to and provided with advice on what the restrictions mean. We don't want people congregating at parks and beaches. Keep to the 2-metre rule. It's really important. Don't go swimming or surfing. A walk along the local beach is fine, but don't do anything that may result in you requiring help if you end up getting into trouble. If people believe that others are not complying with the restrictions, I suggest the first port of call is to talk politely with them and discuss it. If it's necessary and people are clearly flaunting what the rules that we want, you may wish to call the police on 105. If it's urgent, there's always 111, but let's leave that for real emergencies. This weekend is very different from usual. It's important for everyone to stay home and save lives, New Zealanders and visitors alike. You might be tempted to leave the house, but you can only leave home for essential reasons and for physical exercise by yourself or with the other people in your house. Stick to your bubble. By all means, go for a short walk or run in your neighbourhood, but don't go to playgrounds or drive to a beach or park outside your neighbourhood. Stay local. Avoid going at distances, tramping, fishing, hunting, surfing, swimming and other activities at a distance from home. Emergency services are needed to respond to the COVID-19 challenge. Please help them by reducing the chance of any other issues. I've heard today that some people were playing touch rugby and frisbee in parks. That's just stupid. People need to stop doing that sort of thing. COVID can transfer on a frisbee from one person to another. With touch rugby, it's quite obvious. Please don't do it. Don't be stupid. Travelling locally means don't travel out of your neighbourhood and go to batches or second homes. Stay in one place. If you're outside your home, keep physical distance from other people. Give them 2 metres of space. And you can only be in physical contact with those in your bubble, those you live with. Avoid public spaces. Don't touch surfaces others may have touched. Local transport, such as buses and trains, are available for people who do not have other options for essential travel, including going to the supermarket and pharmacy. After touching surfaces on public transport, make sure you sanitise your hands. Please remember that domestic travel around New Zealand, outside your locality, is banned except for essential business and essential workers. This means you can't drive or fly or take a bus or train out of town. Just talking about New Zealanders returning home for a moment, we're continuing to bring Kiwis home and have ensured we have the capacity to accommodate those without a self-isolation plan on arrival, and that includes accommodation and food. I've heard about a lack of food for some returning New Zealanders, and that's not good enough, and we're working on it. Hotels are required to feed guests, and we're discussing issues with them, and we are sending the Red Cross to hotels to help with welfare issues as they arise. We now have the ability to transfer international arrivals to their home base via regional flights specifically for their repatriation home. For those arriving at an international port who are able to get home with no more than 5 hours travel by car, they'll be permitted to do so under certain circumstances. Private vehicle, 1 driver, 2 or 3 passengers. Keeping in mind the social distancing requirements, making sure people have sufficient space and distance to transport family members home. There's no welcome home hugs, strict self-isolation upon arrival home, and that will be checked. I understand that for a number of people, separation from family will put self-isolation for 14 days. It's a distressing situation. It's an uncomfortable experience, and we're making every effort to make sure people's needs are being met. As you can understand, getting New Zealanders home during a state of emergency in New Zealand and the wider global pandemic has been an exceptionally difficult task, and it's important to recognise that this is a huge effort involving both the public and private sectors. Just talking briefly about supermarket shopping, no one needs to worry about supermarkets running out of food. The supply chain is working. Try to avoid long lines at the supermarket over the weekend by shopping during the week. Shop for essentials only. Choose one person to do the shopping. If you need one person to drive, leave them in the car until the shopper comes back to the car. 2 people and groups should not be allowed in together. Respect the need for physical distancing. If you're in the line or in a grocery aisle, stand 2 metres away. If someone asks you to allow them more space, please move. Be polite, be kind. Pack your own bags and keep a distance with trolleys. And a big thank you to supermarket and supply chain staff for keeping this essential service going for us. And when you go home from the supermarket, wash your hands thoroughly. PPE, personal protective equipment. We've had some questions about this. We now have information on the COVID-19 website. I'll just show you an example. There's posters such as this one on the COVID-19 website which provide guidance to people in the health sector and across essential services in the community about what personal protective equipment is needed in their circumstance. I'll just read it right across the top though, because it applies to everybody regardless of what the specific need might be in certain industries. This applies to everybody, and I think it applies to everybody in our community. Basic hygiene measures for everyone include physical distancing, good hand hygiene. As we all walked in here today, me and you, we all had hand sanitizer and we cleaned our hands. Thank you. Cough etiquette. If you're coughing, into the elbow. Don't spread it round. Regular cleaning of surfaces and frequently touched items. Avoid touching your face, eyes mouth and nose. If everybody does that, we'll be in a much better state. So the Ministry of Health recommendations vary depending on what people are doing. Many people, including most hotel workers and maintenance people, many can stay safe by keeping to those conditions I just read out. Others may need some specific PPE. It's clear on the website for everybody to look at and to follow. We're working to ensure that hotels and motels supporting those New Zealanders returning to New Zealand and requiring a place to isolate have the right information and the right access to PPE equipment for the work that they are doing. Remember, for further details, look at the COVID-19 website. And a couple of thank yous. Big thanks to all the essential workers, including health workers, the people who are growing, making and selling food and goods, essential distributors, police, emergency services, transport workers, hotel staff and others. And it's great to see the measures being put in place to keep people safe as well as keeping the country running. Everyone who's staying home, please support essential services workers by respecting all of our recommendations to protect them and you. We're all in this together. Now let's keep up the great work and break the chain of infection of COVID-19. And if you're ever unsure, make sure to look at that website. Just finally, I'll reiterate it, you've heard it several times, it's worth reiterating. Remember the self-isolation rules. If you're sick, stay home, don't go out. Maintain good hygiene with washing hands. Sneeze or cough into the elbow. And while maintaining physical distance, support those who are in need. And be kind to one another.